Today I will be going through a case study regarding an overweight teenager named Jane. I will discuss her background, her family history, her medical evaluation, her nutrient needs, her reported 3-day food diary, and finally some recommendations for her and her family. Childhood and adolescent overweight and obesity is a growing health crisis in the United States. Overweight and obesity are linked to many chronic diseases, and recognizing risk early and implementing prevention strategies is a must to prevent health complications in young clients. Childhood and adolescent obesity is a predictor of adult obesity as well. There are multiple factors that influence excess weight gain. Certain illnesses and medications can cause metabolism to slow, however, this is true in very few cases. Genetics can also play a role by determining hunger hormone levels and receptors in the brain, as well as metabolism and fat storage. However, experts disagree on how much genetics do influence weight gain. Complicating the solution for adolescent overweight and obesity is environmental factors, including socioeconomic status and geographical location. Living in a low-income neighborhood or being from a low-income family is a significant risk factor for childhood, adolescent obesity in the United States. Low-income families must rely on what they can afford and purchase in grocery stores, sometimes forgoing quality over quantity. In the U.S., many packaged foods are cheap and high in calories and lack nutritional density. Families may also turn to fast food as a filling and cheap time-saving alternative, even though these foods are high in sodium, fat, and sugar and low in many vitamins and minerals. Low-income neighborhoods often lack grocery store variety but have high concentrations of fast food restaurants. Geography may prevent families from having access to certain ingredients or access to educational resources or medical services. We'll get to Jane's case. Jane is a 14-year-old female, and she lives with her 2 parents and her 2 younger siblings, aged 9 and 4. The family states that they often run out of money for food by the end of the month, and they often eat fast food to save time and money. Jane was referred to a nutrition specialist because of continuous weight gain. She has gained 10 to 15 pounds per year for the past 6 years and currently weighs 152 pounds and is at 62 inches tall, meaning that her BMI is 28.2, putting her in the obese category for her age. Both of Jane's parents struggle with their own weight. Jane's mom is obese and has hyperlipidemia, and Jane's father is obese and suffers from type 2 diabetes. Here are the results of Jane's medical evaluation. Her review of systems was within normal limits with the exception of her weight. Her vital signs were normal, except her blood pressure was a little bit elevated. Her doctor also decided to run labs such as fasting glucose and a lipid panel, and these 3 were abnormal. Her fasting glucose was 116 when it should be between 95 and 110. Her high-density lipoprotein was 36, which should be greater than 55, and her low-density lipoprotein was 113, which should be less than 110. Being overweight or obese comes with a higher risk of chronic illness, and Jane is already showing some warning signs. First of all, her blood pressure is not initially alarmingly high at 125/82. However, for a 14-year-old, it shouldn't be any higher than the normal of 120/80. While it's not immediately concerning, it does show the potential for a problem with chronic hypertension later in life, and with Jane's current weight and sodium intake, it would not hurt to address this issue early on. Lifestyle changes are the most effective way to manage this condition long-term, and as Jane is so young, this should be the primary intervention. Jane and her family should be educated about all the things that influence blood pressure, such as sodium and processed food intake, level of activity, stress, and sleep. The next concerning assessment is of Jane's fasting blood glucose level. It is 116 when the expected range is between 95 and 110. This is abnormally high, but not high enough for a diagnosis of type 2 diabetes. With Jane's father suffering from type 2 diabetes already, Jane is at an even higher risk of developing this disease. While it is still possible to manage through lifestyle changes, the family must implement changes now to avoid Jane becoming diabetic. Keeping blood glucose levels at a constant, stable level happens by moderating dietary intake of sugar and carbohydrates. Exercise also helps to lower blood sugar levels and increase the body's sensitivity to insulin. Therefore, both activity and diet changes should be made to keep Jane from developing type 2 diabetes. Because Jane is at higher risk, her parents should also be educated on warning signs to be aware of that might indicate Jane has become diabetic. These include increased thirst, frequency of urination, and fatigue. Jane's lipid panel also has some concerning numbers that need to be addressed with her and her family. Her HDL number is lower than expected. Jane and her family should be educated as to how to raise that number. Interventions include consuming healthy fats such as olive and coconut oil, fish, vegetables, and exercising regularly. Her LDL reading is also high, and though, like her blood pressure, it's not significantly over the normal range, it is a cause for concern at such a young age. Jane needs to start incorporating healthy eating habits to lower that number, including lowering her saturated fat intake. Jane's mother has hyperlipidemia, and based on this evaluation, Jane is at risk of developing it as well. This comes with a much higher risk of fatal cardiovascular disease and other health complications. Now I'll discuss Jane's specific nutrient needs. These numbers are taken from the USDA Daily Recommended Intake for Healthcare Professionals calculator website. They estimate that her daily caloric need is 1,891 calories per day, with 213 to 307 grams of carbohydrates, 59 grams of protein, and 53 to 74 grams of fat, keeping saturated fat as low as possible and drinking plenty of water. Here is a continued list of Jane's micronutrient needs, and I won't go over every single level, but there are a couple that I want to go over because they come up later in her food diary. Vitamin D is a vitamin that many people are deficient in their everyday lives, and Jane specifically should be consuming 15 micrograms per day. Having a deficiency chronically in vitamin D can lead to weak bones, increased risk of inflammation, and even death. Calcium is another one that a lot of people miss. Jane should be consuming 1,300 milligrams per day, and a chronic deficiency of calcium can lead to weak bones, stunted growth in children, and muscle spasms. Now we'll take a look at Jane's 3-day food recall diary. We can see that every day there is one meal at least that has fast food in it. She constantly is drinking sweetened beverages, at least one soda per day, and other sugary beverages at other points throughout the day. Many of her snacks and meals have high proportions of fat and sodium and processed foods. So we see some unhealthy patterns in her eating here. I put Jane's 3-day food recall diary into Chronometer, which is a meal analysis website. And this is what I found. On Thursday, her total calorie intake was 3,200 calories. She was in excess in all of her macronutrient levels and deficient in vitamin D. On Friday, her total calorie intake was 3,100 calories. Again, she was in excess in all of her macronutrient levels, and she was deficient in vitamin A, D, E, K, and magnesium. On Saturday, her total calorie intake was about 2,900 calories. Again, she was in excess in all of her macronutrient categories, and she was deficient in vitamin C, vitamin D, vitamin E, vitamin K, calcium, and magnesium. Moving on to recommendations for Jane and her family. Jane should aim for a calorie intake between 1,600 and about 1,900 calories per day. Different sources say different levels for her specific measurements, and if 1,600 is too drastic of a calorie cut at first and Jane is feeling hungry, going up to this higher level suggested by the USDA DRI that we discussed earlier would be okay if that includes an extra snack and improves her compliance with this new program. Jane should aim to lose 1 to 2 pounds per week. Too rapid of weight loss can be unhealthy and isn't sustainable over a long period of time. She should focus on eating quality, healthy, nutrient-dense foods, especially at the beginning. These are more important habits to build than strict calorie counting, so she should really focus on quality. Jane needs to start eliminating soda from her diet. It is really important for her to get rid of those empty calories. Soda is just full of sugar and has no nutritional benefit. And as a growing and developing teenager, she should really stick to drinking only water, milk, and occasionally 100% juice. Fast food is another thing that should be eliminated as much as possible out of the family's weekly routine. For the price of a fast food meal for the whole family, they could shop for and make a quick, nutritious, and filling meal for the whole family. Fast food is okay on occasion, but it's full of fat and sugar and sodium and really should be eaten as little as possible. Jane also needs to get moving. Exercise burns calories, benefits cardiovascular health, and can lower the risk of many chronic diseases, including diabetes. Jane's family should also be making changes together. Studies show that people make lasting changes better when held accountable by and have support from the people close to them. Jane's parents struggle with their weight and chronic illness as well, and these changes would benefit the health of the whole family. Having Jane be part of the process of meal planning, grocery shopping, and cooking is also a good recommendation. The more invested she is in each step of the process, the more comfortable she will likely be with all of these changes. Financial concerns must be addressed when working with families, especially low-income families such as Jane's. Showing the family cheap, healthy swaps at the grocery stores, such as lean proteins like turkey, canned and frozen vegetables instead of fresh, and whole wheat options for their favorite carbohydrate sources will help them make the switch more easily. Offering a meal plan will help them use these ingredients if there's ingredients that they're not as familiar with, so that could be helpful as well. Jane needs to be following up with a medical provider regularly while implementing any new health plan, especially because she had some concerning labs. She should be getting those checked regularly. And as teens who are overweight or obese are more likely to experience bullying, anxiety, depression, and poor body image, as necessary, Jane should be referred to psychiatric care. She might not need it now, but it's something to keep in mind. As Jane's parents reported that they often run out of money for food by the end of the month, it might be appropriate to refer the family to a federal nutrition assistance program. One of the programs available is a Supplemental Nutrition Assistance Program, or SNAP, which provides financial assistance for groceries to low-income families. SNAP Ed provides education on healthy choices, and both could help Jane's family. WIC is a program that would not be directly for Jane, but it would help support the family. Jane has a 4-year-old sibling, and the WIC program supports children up to 5 years old, and that support could relieve some financial food burden off the rest of the family for at least the next year. The last program is a school lunch and breakfast program. Jane and her middle sibling could take advantage of these programs, which provide free or reduced cost meals for school-age children. It would be harder to control the content of what Jane's eating during those meals, but it would be possible to educate her on making the healthiest choices within the meal program if this program is necessary. Finally, we have a 3-day meal plan example for Jane and her family to implement some of these healthy suggestions. The meal plan was made with the recommendation of a 1,600 calories per day diet in mind. If her family relies on the school lunch program for Jane's lunch, the lunches proposed here may not be an accurate measure of intake, and the plan should be adjusted accordingly. This plan aims to model some healthy swaps for food Jane already likes as seen in her food diary, such as a lean turkey burger in place of a Big Mac and baked chicken fingers instead of KFC fried chicken. It is also mindful of the financial situation of the family. While some foods might not be the absolute healthiest possible choice, they are budget-friendly compromises. Some meals can be easily made in large batches to feed the whole family, and some foods are repeated throughout the days to utilize all of a purchased ingredient and show how certain foods can be used in multiple ways. It also includes a recommendation for a once-a-day woman's multivitamin to ensure she's getting as close to 100% of her micronutrient goals each day. So for breakfast for day 1, we have a smoothie using dark berries and sneaking some vegetables in there, some homemade granola, which is low in sugar and has some whole grains in there. For lunch, we have a black bean burrito. Black beans are a great cheap protein source, with some cheddar cheese as a dairy source and some brown rice. After school, we've swapped her chips for some carrot sticks and hummus. For dinner, we've swapped her fast food burger for a turkey burger with a much healthier salad. And finally, she has a little bit of dark chocolate, so she doesn't feel quite as deprived, and dark chocolate is full of antioxidants as well. On day 2, for breakfast, we have some scrambled eggs, again sneaking some vegetables in there, a healthier swap for some breakfast meats that she might like with some whole wheat toast, and some 100% juice. For lunch, we have some lean tuna salad on multigrain crackers with some string cheese and vegetables. For her afternoon snack, swapping out chips for some fruit, and for dinner, baked breaded chicken fingers instead of fried chicken with some baked sweet potato wedges. On day 3, we start her out with some oatmeal for breakfast, which includes whole grains, dairy, and some dark berries. For lunch, we're using that whole wheat tortilla again for a kind of pita veggie wrap with some hummus and grilled vegetables, adding some baby carrots as a snack with her lunch. After school, we have a lean protein source with some fruit, and for dinner, some simple spaghetti with meat sauce, which is something that would be easy for her parents to prepare when they get home from work, with whole wheat spaghetti, some already prepared tomato sauce, and some ground turkey. Throughout this meal plan, we see multiple foods being used multiple times, like the frozen berries, peanut butter, oats, whole wheat tortillas, spinach, string cheese, dried fruit, and hummus. All of these come close to the 1,600 calorie suggestion and meet all of her macro and most of her micronutrient needs as well. Here are my references I used during this case study, and thank you for listening.